people who have a chronic hypertension will have an increased risk of having a aortic valve problem. Now, let me quote one study that was done. This one published in European Heart Journal in 2018. You can look it up. That they did a study for 5 million people in UK. And what they find is they basically compare a patient with normal blood pressure and then patient who have a high blood pressure, defined as having a systolic blood pressure more than 120. And guess what? They found out that patients who have a high blood pressure or hypertension will have a significant increased risk of having an aortic valve problem. It could be aortic stenosis, it could be aortic regurgitation, and doesn't have to be severe. But the number is huge because the increased risk could be as high as 40%. I guess it is impossible to say from the study whether the hypertension is the cause of aortic stenosis. It could be just a coincidental finding because we know the fact that both conditions, high blood pressure and aortic stenosis, could be found in the older population. But if you step back and think about it, with the increased blood pressure for people who have hypertension, it will increase the opening pressure with every single heartbeat. Now, this potentially can accelerate the process of wear and tear on the aortic valve. And if you also think about it, when the pressure increase, it can also damage the cell in the aorta, decrease the elasticity, and then the aortic valve becomes stiffened, and that's what we call aortic stenosis. So I guess, in my opinion, blood pressure should be considered as one of the major risk factors of having an aortic valve problem. Much in the same way as we think that hypertension is one of the major risk factors, as we know, of atherosclerotic heart problems such as stroke or myocardial infarction. And I guess this is important concept for you guys to know as a young doctor and also, other medical healthcare worker. The number of patients who will be diagnosed with aortic stenosis has grown steadily in the last few years. The number will continue to increase. And the reason for that is clear. We are now dealing with the aging population. We need to highlight the fact that this condition, severe aortic stenosis, is one of the medical problem that cannot be treated effectively with the medication. We have several clinical trials, and based on the clinical experience, there is no medication that can cure the problem. We know that the only effective treatment for patients with severe aortic stenosis, once they become symptomatic, when they start having chest pain, they get shortness of breath, the only treatment that works is basically by replacing the aortic valve. Now, as you mentioned before, for the longest time, I would say for the last 80 years or so, we only have one option, basically how to replace the aortic valve by performing an open heart surgery. And this is what we call a surgical aortic valve replacement, or surgical AVR. So this is an elderly population that we talk about. And being an Asian, when 70, 80 years old, you tell the patient you need to go for open heart surgery. A lot of them will say, no, I don't want to go for open heart surgery. They fear of the complication, they fear about the risk, and the fact that they need to stay in the hospital for a long period of time. So if you think about it, before we have TAVI, so what we do for this kind of patient, the patient will just be treated with medicine. And we know, as I mentioned before, it is not effective. So what's going to happen in the next, few months, a few years ahead of this patient. They will not do well. They will have multiple admission for heart failure. They will eventually become very immobile, just staying at home with a lot of symptoms. And of course, eventually will die from the condition in the next 1-2 years. But this one is completely changed when we start having TAVI, right? Because TAVI, the T stands for transcatheter. That's a very important word because we are moving away from doing midline incision in the chest. And in TAVI, the way we access the aortic valve, or how we get access to the heart, is just basically by going through the artery. The most common artery that we use during the TAVI procedure nowadays is transfemoral, so basically around the groin. But this is basically the same process that we have to go through when we do a stenting in the heart. But the main difference is that stenting is usually about 4 to 5 mm, and the valve is 2.5 cm. So sometimes the femoral artery is too small, and then if they have calcium, so we have to find other artery. So the other alternative will be subclavian. We can also go from carotid artery. But the main advantage and the main difference when you compare TAVI and surgery, we do not have to go to the chest. We do not have to do a midline incision. Our access is way less invasive compared to surgery. And that way, this is a major advantage, especially if you deal with the patient who's considered high risk for surgery or elderly patient. Good question. You're asking about the risk. And this is what I always tell the patient. With every medical procedure that you undergo, especially when you're dealing with the heart procedure, there's always risk and benefit, correct? However, you look at all the published clinical trial comparing TAVI and surgery consistently, showing that the patient who undergo a TAVI procedure will have a lower risk of stroke, a lower risk of heart attack, and lower risk of mortality, meaning they have a lower risk of dying during the procedure if they undergo TAVI compared to the surgery. And this number is continued to improve over the years because we use the first generation of TAVI, we moving towards second generation, third generation, and now we're in the middle of using the third and the fourth generation. So the risk is getting lower and lower. It also has been shown that the patient who undergo a TAVI procedure will have a lower risk of getting an atrial fibrillation, which is a very common and very dangerous heart rhythm because it will increase your risk of having stroke. A patient with TAVI have a lower risk to develop kidney injury, acute renal failure. They have less risk of getting a vascular injury and major bleeding. Now, you probably listen to me and they say, oh, that's too good to be true. TAVI is just all about positive. But let me tell you, there's also a negative thing about TRI in which that the patient who undergo TAVI, when you compare to surgery, they have a higher risk to get a conduction problem that will sometime we need to put a pacemaker after the procedure. Now, the number has been getting better. When the first time we do TAVI about 8 years ago, the number is going to be double digit, 20 to 25%. But nowadays, with the improvement of how we do the procedure, the technology and things like that, patient selection, we now decrease the number all the way to single digits. So probably less than 10% of a patient needing the pacemaker. But that's one of the downside with TAVI procedure. But one of the things that I want to highlight is that the major benefit that you see with TAVI procedure, and this is what I see in the clinical practice as well, a patient who undergo TAVI will have a significantly shorter stay in the hospital, both in the ICU and also in the ward. They can go home early, they can go back to their normal daily activity just within few days after they're done with the TAVI procedure. Now, because of all this reason, right, you can see, and this is, validated in the clinical trial, the improvement in the quality of life for patients who undergo TAVI was significantly higher. So let me start with what happened around the world. So if you look at the data around the world, so at this point in 2023, if you pull up the data from especially the United States and the European country, the number of TAVI performed now in that country has outnumbered. So meaning if you translate, there's more TAVI performed to treat patients with severe aortic stenosis than the surgical AVR. And then last year, actually, if you guys, probably you don't know about this, but last year, we actually celebrate the 20th years anniversary of the first ever TAVI procedure performed in human being. The first TAVI was actually performed in France. So 20 years actually is quite a short period of time. It is considered very young for the medical procedure to mature, correct? But we live in the era where the technology advanced very quickly. People learn from each other and then, talking about how we do procedure and things like that. So if you think about it in just relatively 20 years of time, TAVI has completely changed the landscape of how we treat the patient with aortic stenosis. I would have to say nowadays, I can say that TAVI now has become the new standard of the treatment for patients with aortic stenosis. If you look at the most recent updated guideline from US and also a European country, they all say that for a patient who is above the age of 65, TAVI now is the gold standard. So TAVI now is a class one indication to treat patients with aortic stenosis. Now let's talk about what happened in Singapore, at least what happened in my center. So in NUH, we start doing TAVI probably close to 10 years right now. But of course, if you look at the beginning, we don't do that much, and our experience is not that great. But I would say that the greater experience and the significant increase in number happened in the last 3 or 4 years. So we're becoming more confident in how we do the TAVI. We're getting better at getting a very good result, patient selection. And I think what changed the whole thing and what triggered this increase in the number, because the government in Singapore start giving a full subsidy for TAVI treatment for the last 2 years. I'm quite sure, I know probably in Indonesia, this treatment is not subsidized yet. And I think cost will be the major problem in Indonesia. But I have no doubt that this trend will follow in Indonesia in the near future. And I think this region will definitely see a significant increase in the TAVI number performed. In my opinion, TAVI is definitely here to stay. So if you look at the trending, in the past, as long as we can do the TAVI procedure safely, we do the procedure, a patient can make it out from the operating theater, they can go home safely, and that just is considered success. But now what we're trying to do is try to optimize the outcome of a TAVI. We try to achieve perfectness. Is every single TAVI procedure that we done, we try to implant the valve in the perfect position, and we hope that valve will last as long as they can. And in fact, just for example, the way we do a TAVI procedure now in Singapore is, 98% or even more of our patient now does not need to be under GA anymore. So we just give them a little bit of sedation. In the majority of the simple, straightforward TAVI case, we can finish within 1 hour. And majority of the patient can go home if they don't have complication on day 2 after the procedure. And the other thing, I think the future, what you will see is the indication of TAVI will expand. TAVI now is not just used to treat severe aortic stenosis. We use TAVI, and the result was quite good. We use to treat TAVI for bicuspid aortic valve as well. We also use a TAVI to treat patient with rheumatic heart disease who has aortic stenosis. We start using a TAVI in the other part of the valve, like the mitral valve and also pulmonic valve, with the same technique. And of course, the newer use of TAVI is using the TAVI to replace the old surgical valve that's not functioning. So by doing that, you prevent the patient from having to undergo a second surgery. So I guess the future of TAVI is bright, and that's all I can say. And you will expect to see the increasing number of TAVI performed around the world in the region. And this should be followed by improvement on the outcome and the TAVI technology.